Good afternoon, everyone. I've been asked to provide a virtual prayer for a virtual luncheon for a very real cause. We are gathered because of a pandemic that has taken life, exacerbated hunger, and now has begun to threaten the shelter of our poor and middle class. That's why we're all here today, present, despite the pandemic, to respond to this challenge, to the shelter of people who need it and want it and must retain it. Habitat for Humanity needs no introduction, so let's meditate together. Pray to your God. Let's do so, joining all our spirits in mutual respect for our common agenda. Let us pray. God, we are scared. We're angry. We're tired. We grieve. Our family, our friends, our community, our nation, indeed our world has been disrupted in the most terrible way. Today, as we remember all the people who have been affected, we hold in reverence and awe the sacrifices of our fellow essential workers. Somehow, stock clerks, delivery persons, cooks, emergency personnel, hospital staff have become the glue that has and continues to maintain our nation. Please grant them mercy as they care for us. Scripture tells us that what differentiates us from other species is that we are made in the image of God, that humans have the ability to manipulate and create new things. So we pray for the creation of the solution of this pandemic. In the meantime, help us to focus on saving human life, to convince our people to wear masks for the love of their neighbors. Help us to start this minute to do so by seeking to provide and preserve shelter, a habitat for our neighbors and a habitat for humanity. Amen. Thank you, and God bless.
Good afternoon, everyone. I'm Corinne O'Connell, CEO of Habitat for Humanity Philadelphia, and I am so glad all of you beautiful humans have showed up to our virtual luncheon. I recognize how much everyone is juggling, and we really appreciate your time. Thank you, Reverend Cortez, for our blessing. That's our work today, a habitat for our neighbors and a habitat for humanity. I've joked, my job today is a mashup of Tina Fey, Terry Gross, and a little bit of Jerry Lewis's telethon for good measure. But with that in mind, the layout goes like this. We'll visit with a Habitat homeowner, Vanessa. I'll offer an update on a whole lot of Habitat good news, including our good neighbor recipient, Ellen Farber. We'll meet Miss Drina, another Habitat family, and then Dr. Klasko and I, we're gonna roll up our sleeves and get into it and talk housing, health, human stability. Vanessa is wise beyond her years and has some good news of her own to share. Let's meet Vanessa.
I just can't express my gratitude enough for being a part of the Habitat family. When I actually came into Habitat, I was coming in for work. I was coming in to get resources for clients. And then I was really moved by the guest speaker that they had at the training that day. And I was like, I think this is for me. I'm expecting my very first baby. This is a little picture of my nugget, as we have so come to affectionately call my little one. Yeah, it's just an incredible blessing to be able to do that. This is a potential baby room. I have another room that I haven't painted yet. So it feels wonderful to know that this part of my life is grounded, to know that there isn't going to be any scrambling or, just confusion about kind of how bills will be paid. I've been blessed to be in my space since 2017, so I am in the swing of things in terms of managing my home. And so it feels incredible to know that this is like a solid ground, that it's one thing that we won't have to worry about. And we can focus on things like painting the room and picking out which room that baby is going to live in. So I feel blessed, I feel honored, and I am just grateful to be a part of the Habitat fabric.
Vanessa said it best. Her Habitat home feels like solid ground. It is more than just four walls and a roof. For Vanessa and the little one on its way, home is peace of mind. And that notion of home has taken on a whole new meaning. We've been requested, we stay home to flatten the curve. And I think it's created one of the most shared experiences of our lifetimes. We've been asked to stay home to keep ourselves safe, stay home to keep others safe. We are all home together. And we're in the home business at Habitat for Humanity. We have an audacious vision of a city, a region, a world where everyone has a decent place to live. Our work was transformational before coronavirus, and it is even more critical because of this virus. It speaks volumes that 1,357 people showed up today to be together. We have 41 states represented, 5 countries, and a record-breaking audience from folks in the city of brotherly love and sisterly affection. You showed up big today to be together, and because we belong to each other, right? In the midst of so much uncertainty, you showed up. And here's why. Habitat for Humanity builds a shared purpose. It taps into that peace of mind we all desire when we think about home. Habitat offers us a way to do something and to act on our belief that housing is a human right. We've been asked to stay home, and that really only works if that home is safe, warm, dry. And for far, far too many families, home isn't safe, it is not warm, it is not dry. And home is far more than 6 feet away. Home is completely out of reach. But let's talk about the good news. And I need to update my sign from a some good news to lots of good news, because you know what, folks, we've got lots of good news. Our doors are open again. We'll welcome our 222nd homeowner, Essence, and her daughter, Jada, home by the end of the month. Their wait is over. Essence is a certified nursing assistant at Children's Hospital of Philadelphia, and she hasn't stopped working since this pandemic started. I spoke with her earlier this week. Essence said peace of mind will be having their own space. Her excitement, friends, it just was palpable. You could hear it in her voice. She said even if it's, on a blow-up mattress that first night, they are sleeping in their new home. She cannot wait. Our construction team got back to swinging hammers on Monday as well. Now, granted, it's 6 feet apart and with plenty of new safety measures, but Oxford Green, our 20-home development in North Philly, is rolling again. And for an extra dose of optimism, Dale Corporation, their skilled folks are out lending a hand. Their time and talent gives us the shot in the arm we need to catch up on the construction delays at Oxford Green so that more families are home and home sooner. And let's talk about you, beautiful people. You are also part of the Habitat Good News. Over the last 8 weeks, you have answered our rally cry, and your generosity has propelled Habitat Philadelphia through this crisis. Coming into today's luncheon, thanks to the incredible support of our Home Together Fund and our amazing corporate partners, we started our program at $275,000 raised. However, I have just been told we are now at $301,082. And to help motivate you to get in on the giving, we've got 3 amazing, wonderful donors who have put up a $55,000 match. Every dollar donated today is matched dollar for dollar up to $55,000. Added bonus, 100% of your gift goes to Habitat programs. And that's thanks to corporate partners and not having to pay for those plated chicken salads. Our goal is to raise $110,000. And your generosity keeps Habitat's doors open so that more families can open doors to safe, warm, dry homes. At the top of the corner of your screen, you'll see a running total, and this is pretty amazing with virtual technology, right? We can see how we're doing. Thank you. Our sponsors have gone above and beyond this year. When we made the decision and called them to say, hey, we're moving to a virtual event, they didn't hesitate. Their commitment has been steadfast. I want to recognize our signature sponsors, Jefferson Health, Morgan Properties, thank you, as well as our community builders, Cohen Seglius, Chubb, Farber Family Foundation, Hauser. We are here today because of you. Shout outs as well to all of our corporate partners. They're scrolling across the bottom of your video. Your investment transforms lives. Now, folks, if you're feeling it, You can make a gift at any time during the broadcast. The donate button is on the screen. And again, that dollar for dollar match is live. So let's get into Habitat. We rely on volunteers. And up until March of 2020, Habitat Philadelphia volunteers had logged 12,667 hours working at Oxford Green, the Restore, here at the office, on committees. But I want to recognize two here this afternoon. One, Howard Goldblatt. So Howard is a retired carpenter who has come to work at Habitat as a volunteer for as long as I can remember. He had a major health event last fall and has been working hard every day to get himself back to Habitat. And Howard, we can't wait to have you back. And I also want to recognize Bill Hanna. We lost him at the end of March. I want to thank his family for sharing him with us. He's been one of our regulars with Bryn Mawr Presbyterian Church, and we know we've picked up a new hero for Habitat up in heaven. Habitat runs on volunteers, and every year at our luncheon, we recognize a volunteer with the Patrick Monahan Good Neighbor Award. And it goes to someone or an organization that have gone above and beyond. And this year's recipient, Ellen Farber, has done exactly that, gone above and beyond. Thank you, Ellen, for this FaceTime interview. Let's take a look.
I've been involved with Habitat Philadelphia for about 6 years. My initial introduction was to go to the Restore as an interior designer. I quickly suggested that they start to merchandise to make it look like the wonderful store that it should be. We wanted everyone, when they come to the Restore, to be inspired and have a good shopping experience. They were very open to different ideas. I continued to go back to the Restore and brought a group from Harcum, where I went for interior design school for their day of service. One of the things that had always been a goal of mine was to provide nice interiors for people who really couldn't afford them. How to turn a house into a home by putting the furnishings and other items in that make it feel good, that make it functional and useful. Catherine Fernandez, the Director of Development at Habitat, was able to term the project House to Home. Harcum is always very interested in finding opportunities to partner with not-for-profits, and the support of Habitat was so strong with that process. Rita, the Director of Social Services, found just the right person to do this project with us. The students interviewed Latasha. We gave them a budget because this was a situation of make it functional, make it pretty, make it warm, make it feel like home. And they did an amazing job putting renderings together to explain to Latasha what they had come up with based on her preferences and her family, really empowering her to feel in control of what it was that was going into her home to welcome her family into it. So I basically went out shopping with Latasha to implement what the plan was. We must have gone out at least 5 times, and our first stop was to the Restore in Philadelphia, and we had a lot of fun. It was really fun. I have been wanting to go on a global village trip for a few years. Not having any building experience, I was a little scared about what that would look like. The staff and everyone involved in the Habitat community in Guatemala stepped in to show us how to be a contributing member and make a difference. And so we started foundation for a house, and we also worked on building stoves for people in villages. And to see the looks on not only the kids' faces, but really in the faces of the parents as to what we were able to give to them to improve their lives. When you see how happy they are with their own environment, is all the payback you need. It was really touching to see how the Philadelphia team could so selflessly work so hard for other people. I really enjoy working with all the people at Habitat Philly, and they've been nothing but wonderful to me. They've always gone out of their way for me, which is why I go out of my way for them.
Ellen does way more than go out of her way to help. She's the first to raise her hand, to put up a challenge gift, to launch our women's build, to jump in on a committee. And by the way, I don't know anyone who gets excited about balance sheets and P&Ls, but Ellen sure does. She staged the Restore, Habitat Homes, and even my office. And most recently was like the Pied Piper in Guatemala. She packed a spare suitcase with coloring books and matchbox cars and jump ropes and bubbles. And there was just like this swarm of little kiddos following her wherever we went. Ellen, you are loved dearly. Philadelphia is a better place, and more families in our city have a decent place to live because of you. Thank you. Congratulations on this well-deserved Good Neighbor Award. Okay, so my people have slipped me a number, and we're going to just check in. That number is moving. We're at $321,482. That's astounding. Just remember, we've got that dollar-for-dollar match. And if you want to think about it in tangible terms, $100 builds 1 square foot of a safe, warm, dry home. All right, so before I roll up my sleeves here with Dr. Klasko and really get into talking health and housing, let's meet Miss Drina. She came to Habitat through our Capable program. And this innovative strategy is critical as we address the aging housing stock and aging population in the city. Capable integrates housing and medicine, and it combines the expertise of nurses, occupational therapists from Jefferson and Drexel alongside Habitat. And these home improvements empower elderly homeowners to safely age in place in their homes and on the blocks where they've lived for decades. Let's meet Miss Drina.
I had 9 children, 9 boys, 1 girl. We raised all of the kids and the grandkids and the great-grands, and I've been here since '74. It's North Philly, the heart of North Philly.
This is a home that's been known throughout the years that everybody could just come. The doors are always open. If you come, you're gonna get something to eat. You're having some troubles, my mom is gonna hear you out until things get better.
Last year, I got sick and I wanted to leave. I lost a lot of weight. I couldn't stand, couldn't walk, couldn't sweep the floor, couldn't step and sweep this whole floor.
My mother had been having some breathing issues. She was always complaining about upper respiratory. Had no clue it was from the house.
The smell of the furnace, the smoke and stuff that was from the oil, I didn't realize that was such a hazard to my lung condition. I had no idea. And being in this house all these years with that oil, I didn't know.
A lot of people want to stay in their home. It keeps them more independent than moving away into a facility. And so the Capable program and keeping people in their home actually is really supporting the health of older adults. We did make some changes in Miss Drina's home to make it easier for her to breathe. I know some of it was having the city come take the oil tank out. And she has an air quality monitor now, so she can actually see what's going on in her own home. She had a lot of concerns about the safety of her home. And so we put up bars in the bathroom and on the stairs, got some bed rails and other little gadgets that would help keep her from having to bend over as much where she might fall.
The Capable program is a program that helps you maintain your goal of life that you want to live, or it helps you get back to that.
The Capable program does require a little bit of a different approach. It's put around onto the homeowner, the client themselves, and we brainstorm strategies together. I take on more of a role of a coach, actually.
The goal was I wanted to be able to walk, I wanted to be able to stand, I wanted to be able to move, I wanted to be able to walk at least a half a block. I wanted to be able to sit at the table and read a book. And she said, well, we're gonna help you do all that.
But then the really exciting part was when I came in for our 3rd visit, we were going to be working on remembering doctor's appointments, and she already had strategized the whole thing out. She looked at me and said, I know what I'm going to do. I said, okay, great, what is it? I'm going to use my computer calendar to do it.
I didn't know how to use a laptop, so she took time. She came and showed me the commands, and it's just been wonderful because I didn't know that part of the computer.
And that actually right there, I think, sums up the Capable program. Some small changes and in the home itself, and also just with strategies and other tools that we could give her, have really just made her blossom as a person. And if I could sum up our experience, the word I would use is empowerment.
Not only they helped me maintain it, my house, just keep me here, they enhancing me. I can get up and live now the rest of my life now, comfortable.
I know the things that you guys covered, we couldn't afford them. What Habitat did, they took the stress off of all of us in helping my mom, and they added quality of life to her life.
Habitat means somebody care. It's a great thing with Capable, with them. She gave me a reason. She gave me a reason to want to stay. Gave me a purpose to want to be here again.
Habitat means people care. Miss Trina, we care. And I just love that notion of I have purpose again. To date, we have built and sold 221 homes in our city and provided critical repairs to nearly 600 homes like Miss Trina's. But to put the need for housing into context, at the first of the month, right, so May 1, 1 in 4 families made the hard choice to pay rent or put food on the table. And there are 136,000 owner-occupied homes in Philadelphia that are literally falling down around the people who live there. That is a daunting number of people where home is either out of reach or where they live is a barrier to their health. And as we think about the road ahead and our collective health, housing will be critical to build our community's resiliency and our immunity to this virus. And the road ahead will also require plenty of innovation, leadership, and a willingness to do things differently. But before I get to Steve Klasko, I'm just checking on our number. We're at 336,000. Amazing, and thank you. Dr. Steve Klasko, president of Thomas Jefferson University and CEO of Jefferson Health, is the epitome of an innovative leader willing to do things differently. I am grateful to the entire Jefferson team who are going the extra mile, the extra step to keep us all healthy. I appreciate Steve making the time today and for the ongoing partnership with Jefferson. Steve believes your zip code should not determine your health, and Habitat agrees 100%. Ladies and gentlemen, Dr. Steve Klasko, joining us live from his office at Jefferson. The virtual stage is yours, Steve.
Well, thank you so much, Corinne. And I couldn't think of better people I would rather share a virtual lunch with than you, Ellen Farber. And by the way, Ellen Farber is great with a lot of things, including balance sheets, and she certainly got a lot of that from her dad, who is the best on the planet of that. A great friend to Jefferson, a great friend to us also. And also Reverend Cortez. We could not be prouder of the work we're doing with Esperanza in much the same way. So I guess we have to roll up our sleeves, so we've got to start that way. And I think I want to start by just, again, making sure we all recognize the healthcare heroes out there that are, as we speak, on the front lines, taking care of patients, in some cases cleaning the rooms of COVID patients, and are housing vulnerable. And the work that you're doing is just unbelievable. But I want to put it in this context. In 1966, the #1 song was You Can't Hurry Love by the Supremes. Today in 2020, the #1 song is Stupid Love by Lady Gaga, a lot different. In 1966, the #1 movie was The Good, the Bad, and the Ugly. Today, the #1 movie is through a streaming thing called Netflix. In 1966, I had a lot of hair. You know the story there in 2020. But in 1966, Dr. Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And unlike all those other things that have changed, I could have started this by saying in 2020, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I think when we think about that, and as people are thinking about giving money to this amazing cause, anyone that is proud to be in Philadelphia has to take a look and say, why is it that in a city that has 6 great academic medical centers, 20 or 30 great hospitals, we have the greatest discrepancy in life expectancy by zip code? We all love the statue of Rocky, but if you go 5 miles one way versus Rocky to 5 miles the other way, there might be a 21-year difference in life expectancy. It's It's not because Jefferson or Penn or Temple or Drexel are doing anything wrong when patients come to the hospital. It's because we've ignored where healthcare starts. Healthcare starts at home. That's a fact. And if you don't have a home, it's very hard to have health start there. So we have to stop thinking about sick care. We have to stop thinking about health care. We have to start thinking about health assurance. In fact, I have a book coming out in 4 weeks called Unhealth Care, the Manifesto for Health Assurance. People don't view themselves as patients. They want to be able to thrive without health getting in the way. And the way to do that is through food, education, and housing. And what you folks are doing at Habitat for Humanity, and we're thrilled to be part of the Capable program, just as one thing, is really starting that journey of having Philadelphia be a healthy city. You know, one of the things I'm incredibly proud of the board of Jefferson is when I got here in 2013, almost every one of the academic medical centers had pretty much the same mission. It was, we want to be the premier academic medical center in Philadelphia, or we want to be #1 in U.S. News and World Report. Well, other than you and your mother, nobody really cares about that. We changed our mission to we improve lives. That was more than just 3 words. That meant that I and we were not successful unless we were going out into the community and improving lives. And just to put a little flavor on that, what my board decided to do is that 25% of my incentive is based on reducing health disparities in Philadelphia, most of which I have no control over. But what it's led to is a lot more discussion with the African American community, with Reverend Cortez and the Latino community, with the Southeast Asian community. It's led to the partnerships with Habitat for Humanity and other organizations being the core of what I do and what we do at Jefferson, not just sort of something that's lateral. So if there's any silver lining to come out of this horrible once-in-a-century global pandemic, it's that I think we've recognized that while healthcare, once you get into a hospital, is great in this country, health is broken. And just to put that sort of a little stronger thing, and trying not to be political, I gave an interview where I said, Senator Sanders was 100% right about the problem and 100% wrong about the solution. And I think government has probably shown that, the pandemic has shown that. The problem of the fact that we have a fragmented, broken, expensive, and inequitable system. And the key is not just how to pay for that broken, fragmented, expensive, inequitable system. I think the pandemic has proven that. I think the pandemic might have also proven that maybe having government run it might not be the only answer. But the only way out of that, the only way we can be proud of Philadelphia when all this is done, is if the pandemic and the heroes that are working at each of our hospitals today really taking care of patients. That out of that, the sunshine is that we are working and devoting our lives and our dollars to make sure that every single person has a home, every single person has broadband, every single person has access to have them and their family thrive without health getting in the way. That is attainable. We have done so many other things. That is attainable. And I want to just spend a minute on the home and broadband perspective. When you think about the fact that our school system was not able during this pandemic to basically provide education, because 20% or so of the children in our great city don't have broadband or don't have stable housing where they can have broadband, that should be like electricity or plumbing. So we will not be a successful city despite everything we've done unless we work with entities like Habitat for Humanity, unless we all get together. This is not competitive, to make Philadelphia the healthiest hometown in the country. And that's going to start at home. And I think that I hope and expect that people will be so moved, Corinne, by what you said and by the great work that Ellen Farber has done and others, that those numbers will just start to balloon while we're talking. So I'm thrilled and honored to be part of this. I feel that I'm just doing my job, but the fact that you chose to honor me with this award is fantastic. And we are blessed to have you and Habitat in our city, and I couldn't be more optimistic about the future given some of the things that you've shown today.
Wonderful. Picking up on that thread of optimism, I very much appreciate that. And I think that also speaks to 1,300 people who have tuned in and are listening from home or wherever they are, right? To understand and to act, and that collectiveness. With an audience of 1,300, and given your expertise as an MD and a CEO, can you just give us a high level, Jefferson on the leading edge, you said it, your mission is we improve lives. It's not healthcare in a hospital, it's outside. But can you unpack for us a little bit population health? What are we talking about in that language? Or, oftentimes you also hear social determinants of health. Can you help us understand that?
Yeah, I think what it starts with is that 80% of a person's health has nothing to do with any of our hospitals, our doctors, our nurses. 80% of health is social, what we call social determinants of health: food, education, housing. That's where it starts. The problem in the United States is that we spend about 90% of our dollars not in those areas. So if we really wanted to improve health, and you can take Philadelphia as a great example. I mean, I gave you the life expectancy difference. We're an amazing city when you think about all the research that we're doing and everything going on, even with these vaccines. We have a vaccine, there's lots of other vaccines going on, but we're somewhere around number 38 out of 51 metropolitan areas in health. How can that be? It's food, education, housing, and poverty. So when we talk about population health, we're talking about not what happens when somebody comes into a hospital or a doctor's office, but how can we as a community ensure the health of a large population? That requires data, that requires taking care of things like food deserts. I think some of that is technology. I think artificial intelligence is going to help that a lot. You look at what's been able to happen with telehealth.
Right.
We've gone from 50 telehealth visits a day to 3,500. Well, the fact is that many underserved folks can't get into an office, but they have an iPhone. Just one little anecdote. When I was at Davos this January, one of the CEOs of one of the major finance organizations said, "Steve, 20 years ago, banking and medicine were the two sectors that had escaped the consumer revolution. Now you're alone." And as I thought about that, 20 or 30 years ago, we would have been talking during the pandemic about people lining up in the bank to deposit their checks on a Friday. Well, obviously that's not an issue because literally banking has moved from the bank to the home. Healthcare needs to do the same, but it can't happen till everybody has a home.
Yeah, I agree 100%. So on that, you've spoken on many more of these and larger stages, obviously at Davos than I. But I often get asked that question, or I often start my remarks in that Philadelphia is the largest poor city. And so when we think about health starting at home, when we think about social determinants of health, how do we get that albatross, off us? How do we disrupt when how do we disrupt poverty?
So look, I think I wrote an article for the World Economic Forum called "Dispelling the Myth of Non-Disruptive Disruption." Disruption it gets bandied about too easily nowadays. It means that some people are going to have to give up some things that in order to disrupt positively a city. So the simple answer to your question is, first we have to acknowledge the problem. We can't keep saying what a great healthcare city we are when we're not. It's a little bit like, if you're drinking too much, which probably that fits a lot of people now during this pandemic. But the fact is, the first thing you have to say is, I'm drinking too much before you can go and take care of it. I think we have to recognize that we have a health problem in this city. Okay, so now I've decided I'm drinking too much. I have a health problem, whatever it is. Then the next thing is, how do I cure it? And I think once you do that, you'll recognize that A, I need to care. B, I need to make sure that I am putting my efforts and dollars into the things that are going to make the most difference, like Habitat for Humanity. So let me give you just an example of something that Jefferson did. We started something called the Philadelphia Collaboration for Health Equities. It doesn't have a J in it. It has very little to do with Jefferson. It's what started some of our relationships out in the community. And our last two galas have literally been not to get a bigger MRI or linear accelerator, have been to promote that Philadelphia Collaboration for Health Equities. If every single business in Philadelphia said, I'm not going to feel like I succeeded as a CEO or as a business unless I've started to address the problem of housing, education, and food in Philadelphia. We have the wherewithal to do it. We have the smarts to do it. We have the dollars to do it. And we can't just depend on government. It really has to be individuals, business, and great community organizations like Habitat for Humanity.
I agree. And my last, and then we're going to get to some lightning round questions. So in the space of innovation and in the space of collaboration and partnership, right? Again, words that we bandy around often. 5-10 years ago, Habitat was just construction of new homes. And then fast forward, the fastest growing program for us is the home repair program. And recognizing the housing stock of the city where we are. The most cost-effective home is the one you're living in, and we're not going to build our way out. So as an example of innovation here and a partnership, I'm just curious from, again, your lens as you're looking at, from your seat and from your 40,000 view at Jefferson, where do you see spaces of partnerships or innovation? And again, you're on the leading edge of this when I think about the Philly U merger with Jefferson. Like, what do you see ahead?
Yeah, a lot of the merger with Philadelphia University was based on the design of the human experience, which starts at home. So the thing I'm most excited about, the thing that I spend more of my time doing, the thing that gets me to Palo Alto once a month back when we were traveling, is really looking at how the fourth industrial revolution, artificial intelligence, 5G, robotics, can really make a difference starting at home. So I see 5 or 10 years from now, we're working with Habitat Humanity in a very different way, in a much more robust way. Because as you're building your house, I'm working on the artificial intelligence, the wearables, so that when somebody who has asthma wakes up in the morning and talks to their Alexa or whatever, the Alexa is saying, before I do anything else, could you take another inhaler because your respiratory rate was a little labored. Our car sends more data out very often than humans do, and that's what we're working for. So I would look instead of talking about the Internet of Things, I hope that you and I are working together, that as you build a house, we're creating the Internet of You for every one of those people that is getting a new house.
Amazing. We're ready. We're ready. All right, so lightning rounds.
Okay.
Somebody on your team gave me a tip that you were a DJ in a past life. So that's for our next luncheon. We'll get into that.
I was little Stevie Kent on WYSP, for those of you who are my age.
That's amazing. I was just the DJ at the Great American Pub, so different scale. But it was all the beer I could drink, and it was $100. Okay, pandemic playlist. I hear you have one. What's your go-to song?
Yeah, on Spotify, I have something called Corona on. Look, there's some obvious ones like the importance of social isolation, can't get next to you, don't stand so close to me, the new COVID way of love, dancing with myself. But I think the one that I probably feel the strongest about is there was a song by Smokey Robinson and the Miracles called "Who's Going to Take the Blame?" And I think that what I'm really hoping in this presidential election, that we start to look at the COVID crisis and the health equity crisis and the housing crisis like we looked after 9/11. Let's come together. This isn't a Democrat or Republican thing. We failed to keep the country safe in 9/11. And I'm hoping that we stop blaming each other and arguing about who's going to take the blame. And we start to say, we have failed to keep our cities and our rural areas healthy through food, education, housing. And both parties start to address how we do that. I'd love to see a 9/11 type commission for healthcare, health equities, and housing.
It's amazing. Okay, favorite spot in Philly?
There's so many, but look, I'm a marathon runner. I just love Wissahickon Park.
You stole mine.
It's just
I'm with you.
You feel like you're in France. Just literally doing. You could be any place. So I love that.
Yeah, it's a gem. A go-to movie. It's on at any point. You sit down 2 minutes in or 2 minutes from the end. What's your go-to movie?
Well, look, I'm a huge science fiction fan. So may the force be with you. Any of the Star. I'm such a geek that my son and I spend our birthdays watching all 9 Star Wars movies. Don't like to admit that to too many people. What about you, Corinne? Let me ask you this: What are you streaming nowadays on TV?
I'm watching for my third time, not in the quarantine, but third time Friday Night Lights. Cannot get enough of it. Clear eyes, full hearts, can't lose. That's for sure.
One more question for you.
Sure.
Things open up. What's the first meal you're having in Philadelphia when you can actually get out?
I'm a kind of a meat and potatoes, and I love Winnie's in Manayunk. It's in my neighborhood, and I love Winnie. So yeah, I would head to Winnie's for one of her killer burgers. What about you?
So I live on 3rd, like between South and right around 3rd and South. So I'm a huge Serpico fan.
Okay.
It's right on South Street, and just the vibe and the whole cuisine is awesome.
Good. All right. So I have one last for you, Steve, and then we'll let you go because you got some other things to do today. What's your moonshot idea? You've got all the resources and nothing but green lights ahead of you.
So my moonshot idea would be that we would create an aligned payer-provider type model where everybody is given the technology that they need, just like the iPhone created a wow movement, that everybody would be given the technology they need to have their healthcare continuously monitored, that AI would be able to predict who is going to get ill, that we would be able to take care of those folks before they do, and that we would start to pay healthcare entities and payers to work together to keep people healthy, not just to take care of them once they get sick.
That's great. That's great. All right. Awesome, folks. So, Steve, thank you. Thank you for your time, your candid remarks.
My sleeves back now? I'm rolling down my sleeves again. Okay.
Oh, good. Well, you've helped us. So our number right now, we're at 370,000. And friends, we are in striking distance of raising $400,000 today. So I encourage you.
$30,000. Go do it.
We can do that. It's totally doable. Thank you again, Steve.
I want to commit $1,000.
Yes.
So
look at that.
Now it's just 29.
Awesome. Amazing. Congratulations to you on this very well-deserved award as recipient of Habitat's Healthy Community Achievements Award. I acknowledge you, right? Your vision, your leadership. We improve lives, and not just words, but the resources you've committed to health equity. It speaks volumes about the future you're building now, and a future where a zip code does not determine health outcomes. And I will take you up on that. We'll go to your restaurant. I think it's a little different price point than my burger. Or we'll go to both, right? But we have a really lovely award to give you that we will when we can be together safely again. So thank you.
Thank you, Corinne. And I
right.
want to thank all 1,300 people that are donating. Thank you so much.
Yeah, amazing. Thank you again. All right, friends, we are on the home stretch. So the dots are not hard to connect. Housing stability increases health stability and positively propels our collective human resiliency. Housing is medicine, full stop. Miss Drina, home has provided purpose and empowered her to improve her health. There's Vanessa, right? Her Habitat home has provided peace of mind as her family prepares for her first baby in August. And there's Essence, soon and very soon. I saw her this morning in her whole, outfit she's at CHOP, and I saw her face and she just said, I cannot wait. I can't imagine, right? That key in the front door, that first time, soon and very soon, they will be home. All 1,300 of us showed up today because we belong to one another and to act with purpose. My health, your health, our collective health depends on us belonging to one another. Literally, our lives are in each other's hands. And we're reminded of that just as many times as we wash our hands. My life is in your life's hands. And we have an opportunity today to unleash the medicinal power of housing to create a healthier future for everyone. And I would argue it's not an opportunity, it's an obligation, and an obligation to invest in housing to create a healthier future. Crisis is the mother of innovation. The time is now. Belonging, purpose, and peace of mind. Possible because of Habitat, made possible by you. Your investment today results in homes built tomorrow. Your generosity strengthens our collective resilience. It strengthens our health, and it increases our belonging. A gift of $1,200 supports the Capable program, that aging in place modifications that can take place in the home. A gift of $500 is mortgage relief for a Habitat family. They own their homes, they pay the mortgage to Habitat, and they are struggling in this crisis. $250 is a front door. Think about it. Key in the front door, peace of mind. $100 is 1 square foot of a safe, warm, dry home. And if you've been with us before at this event, we've always had a suggested gift amount. Nope, not today. Every single gift belongs. There is no such thing as a gift that is too big. Just keep adding zeros. Or a gift that is too small. Every single dollar opens doors. Every single dollar increases our belonging. The donate button is always on, right? So Spirit moves you later today, give again. If you'd prefer to put a check in the mail, rest assured we'll deposit them, right? Old school, my mother is putting a check in the mail. Our address is on our website. And I also understand that housing, affordable housing, it's not just a Philly issue. Nope, the need for housing is in every community. So if you've logged on from Hawaii or Idaho, wherever, and you prefer to support your local Habitat, go for it. I want you to know that your actions today to show up, to give, they are humbling, they are motivating. Your actions change lives. We're at $372,760. That is absolutely astounding. And I don't know about you, but that number and our actions today has restored my faith in humanity. We belong to one another. And I'll leave you with one of my favorite quotes by Ram Dass. And he says, at the end of the day, we're all just walking each other home. That's it, folks. Side by side, hand in hand, home together. Thank you so much for walking every step of the way alongside Habitat Philadelphia.
It's pretty incredible that we have over 1,000 people here with us now, part of our Habitat family, joining from all over the country and all over the world, something that we certainly can't do with our traditional lunch format. This is my 6th year serving on the board of directors of Habitat and my 2nd year as the board chair. I do this work and it energizes me because, first and foremost, home is foundational. After spending 8 weeks at home, this point is more poignant than ever. I do this work because as a City of Philadelphia resident, a mother, and a real estate developer, affordable housing is one of the most important issues facing our community today. And I do this work because what we do at Habitat sets the stage for generational change. I want to express my utmost gratitude to the board of directors team that I get to collaborate with. This group of passionate individuals has consistently gone above and beyond the call of duty. In this unpredictable time, we have all rallied even more tightly around our cause. I want to acknowledge Corinne and her exceptionally talented team. This team pours integrity, determination, and selflessness into the work that they do every single day. And thank you to our volunteers who work alongside on our construction sites, at our restore, and serving on our committees. We cannot do our work without you. What brings us all together is our affinity for the greater mission of Habitat for Humanity Philadelphia. But what binds us together is our deep care for the organization. Thank you very much to our keynote speaker, Dr. Stephen Klasko from Jefferson Health, for sharing your time and expertise with us today. Our work at Habitat is possible because of the generosity and the support of our sponsors. We want to extend our appreciation towards our lead sponsors, Jefferson Health, Morgan Properties, Chubb, Cohen Saglius, and the Farber Family Foundation. Thank you. I look forward to being with you all at one of our home dedications soon. Please stay safe and be well.